The next step is usually suggesting a diagnostic laparoscopy, because the investigations that we have done till now is basically to make sure that the tubes are fine, probably with an X-ray and a hysterosalpingogram and a scan to make sure that the uterus looks normal. Now the next step in terms of investigating as to why they haven't conceived with 3 to 4 cycles of IUI is probably a diagnostic laparoscopy, which in fact gives us a thorough and a better visualization of all the organs. We look inside the cavity of the uterus with a hysteroscope, make sure that we haven't missed out any polyps or any septals or any fibroids that are impinging into the cavity. We also, with a laparoscope, have a look at the anatomy of the uterus and make sure that's fine. We also look at the tubes and the ovaries, and we also do what is called as a dye test to make sure that the tubes are patent. During this diagnostic laparoscopy, we would be able to diagnose some problems which probably the scan or other investigations haven't picked up. And the other conditions that can be picked up on laparoscopy is endometriosis, which can be treated at the same time, which helps in the results of the following treatments, whichever we would prepare to do or whichever we would advise the patient to do. The second thing is if there are any adhesions, which are basically stopping the motility of the tube in terms of picking up the egg during ovulation. So if there are any adhesions also, it gives us an opportunity to correct it at that time. If it's endometriosis, like we have already said, and if there are any cysts in the ovaries, we try to treat it at the same time. So laparoscopy answers some of the questions as to whether there were some other conditions which haven't been picked up by routine investigations, and also gives us the opportunity to correct it at the same time. After laparoscopy, there is an option of going for at least another 2 to 3 cycles of IUI. Now totally what we do suggest is 4 to 6 cycles of IUI should give us the required success with the treatment that we have suggested.